Good morning, everyone. Welcome to today's meeting of the New Jersey Cannabis Regulatory Commission Board. The time is 11:13, and I call this meeting to order. Mr. Saeed, can you please read the notice of the public meeting?
Chairwoman, this is a regularly scheduled meeting of the New Jersey Cannabis Regulatory Commission's 2024 annual meeting schedule. Adequate notice of this meeting has been provided in accordance with the Senator Byron M. Baer Open Public Meetings Act. Notice of the meeting was provided to the Asbury Park Press, Bergen Record, Courier Post, Star Ledger, and the Trenton Times on December 12, 2023. The agenda and information regarding the in-person meeting and the ability to live stream was also posted on the CRC website. The meeting time and location has also been posted on the website of the New Jersey Cannabis Regulatory Commission and with the Office of the Secretary of the State.
Thank you. Can you please take roll call?
Commissioner Barker,
Present.
Commissioner Del Cid Coso,
Present.
Commissioner Nash,
Present.
Vice Chair Delgado,
Present.
Chairwoman Wainu.
Present.
We now have a quorum. The first order of business is for the Commission to go into executive session to discuss legal matters and litigation updates. These are discussions that are not shared with the public. We believe the executive session should take about 60 minutes.
Thank you. Is there a motion to go into executive session?
Madam Chairwoman, I move that we go into executive session.
Second.
Moved by Vice Chair Delgado and seconded by Commissioner Del Cid Coso. Is there any discussion on this motion? Hearing none, all those in favor of going into executive session say aye.
Aye.
All those opposed say nay. And any abstentions? All right, the motion passes. Again, we expect the executive session to last approximately 1 hour. So we will leave the live stream running during that time. For any staff members who are in the room, they will not be able to answer questions about the items that are up for consideration at today's meeting. But we can expect the public session to resume at 12:16. Thank you. Welcome back. All right, thank you. The time is 1:05, and we will resume the public portion of this meeting. Before we get started, I want to note very quickly, two agenda changes. So if you are looking on our website, number 7, consideration of modification to delegated authority, that is being removed from today's consideration. And there is one application at one annual license application that is also being removed from consideration today, but Director Brown will note that when we get to that portion of the meeting. All right, so with that, Mr. Saeed, can you please announce the next agenda item?
The next item on the agenda is the approval of prior meeting minutes.
Thank you. The meeting minutes have been shared with all the board members, and there was one change to executive session meeting minutes. But if there are no additional edits or changes needed to the meeting minutes, I'll ask for a motion on the matter.
Madam Chair, oh, you want to go?
Motioned.
I second.
So Commissioner Nash moves to approve the meeting minutes from the January 17th meeting, seconded by Vice Chair Delgado. Is there any discussion on this motion? Hearing none. All those in favor say aye.
Aye.
All those opposed say nay. Are there any abstentions? Motion passes.
Next item on the agenda is the chair's report.
Thank you. So first, I want to, happy Black History Month to everyone. And I want to make a couple of quick notes before I dive into some of the priorities for the board. Next slide, please. Next slide, please. Thank you. So I want to remind folks of the application review process and the time that it takes to get through the application review. So in total, we're looking at approximately 21 weeks for our annual license applications, conditional license applications. As Director Brown has previously said many times before, tends to go much faster. But I want to reiterate this timeline for folks so that everybody understands that all of your information needs to be submitted and reviewed by staff before you get to step 4 there, before the staff engages in review of the qualification for your licensure. All of the information required by applicants needs to be provided. That includes fingerprints, but not just submitting your fingerprints, but also getting the background check results. So I know that there are some folks who were under the impression that submitting the information before a board meeting inherently means that you can be added to the agenda for a board meeting, but we actually do need a lot more time in advance so that all of our investigators and board members have the time to review your application. So please make sure that you submit all the information that you need to submit to maximize your chances of getting your application heard soon. Also, I want to note that at the board's request, the commission is updating the disclosure forms that are part of the application to clarify the information that needs to be provided, including information on all owners and their ownership interest, and any past or pending civil lawsuits. So these updated forms are meant to take the guesswork out of the applications and help streamline review of the forms that are submitted. So be on the lookout for those updated forms. They will be posted to our website. Next slide, please. Last month, I did note that this year, in 2024, the board will continue building on our successes thus far. And so I wanted to take some time to highlight for you all the priorities for the board. And I think in sum, the theme of the commission's priorities this year can be summed up as transparency and accountability, both for the agency and for the industry. So these are vital to the successful implementation of the NJCRC's rules and ultimately to realizing the vision for a cannabis industry of safe and responsible operators. So among our priorities, enhancing agency monitoring of cannabis activities and enforcement of rules to prevent illegal activity and protect public health. We intend to do this by shoring up our internal policies and protocols to ensure regulatory policies are being properly applied and publish a written policy on the agency's approach to compliance and enforcement so that regulated businesses know how regulatory issues will be addressed. We'll also look to maintain the agency's momentum on public engagement by conducting roundtables between the Board of Commissioners and the public, key stakeholders, key surrogates, as Vice Chair Delgado likes to call them, and regulated businesses on targeted subject matters and areas of concern to identify opportunities for industry improvement. And where appropriate, we'll also look to ensure that input from patients, businesses, and consumers is solicited on policy ideas in a transparent manner before our agency formally proposes new rules. Also, we look to update our agency regulations for medical and adult use cannabis regulation, for the medical and adult use cannabis industries. We'll propose new regulations that implement the J. Koenig law, amend medical regulations to eliminate discrepancies between medical and adult use industries where allowed by law, and amend the adult use cannabis regulations to clarify agencies' regulatory policy on application requirements and enforcement of the rules. Fourth priority here is to conduct timely industry assessments to evaluate the impacts of the agency's regulations and state law. We'll do this by soliciting feedback from applicants and license holders on the licensing process and industry sentiments. So things like the processes parts of the processes that work well and areas for potential improvement. We'll also work with regulated businesses, patients, and healthcare industry leaders to identify possible ways to reduce patients' costs for medical cannabis and use available research and data collection capabilities to drive informed policymaking. And then finally, our fifth priority for the board here is to advocate for operational resources needed for the agency to efficiently and effectively carry out its duties. So we'll do that. Part of that work will be where needed, requesting additional resources to support new agency functions. For our committees, next slide, please. For our committees, we have several committees here at the Commission. Some of our priorities for those groups will be to adopt statutorily required annual reports for all of our years that are still outstanding. That's years 2019 to 2023. Monitor and analyze customer complaints to identify any safety concerns and recommend any appropriate action to address those concerns. Execute an agreement with a public research university to conduct the study of the agency as required in the CREAM Act. Solicit industry feedback on the agency's licensing and permitting process and recommended actions to clarify procedural requirements and reduce barriers for businesses. We'll also look to recommend improvements to the license and permit renewal process to reflect the agency's policies and enhance transparency and accountability. Increase healthcare provider participation in the medical cannabis program. And we do need to make some changes to our agency's bylaws, so we'll look to convene an ad hoc committee to recommend any changes to those bylaws. So I do want to note that it is possible that not all of these stated objectives may be accomplished this calendar year due to time constraints and the need for requisite approvals. But I do believe that making significant progress towards these goals is doable this year. And I am happy to say that the Commission is already making progress on some of these 12 priorities, some of which you'll hear about today, actually. And while being reactive is sometimes necessary to respond to unexpected or emerging issues. It is imperative that we remember that being proactive is the only way to ensure that we are reaching our goals together. So as progress continues, the commission will share updates at our public board meetings so that the public stays informed and we demonstrate that we truly are committed to transparency and accountability. That's all that I have for today's chair's report.
Next item on the agenda is the Executive Director's Report.
Thank you. Director Brown, the floor is yours.
Thank you, Chairwoman. Thank you, Commissioners. So I'm going to be brief here, and then I'm going to turn it over to a couple of our staff members. But just at the outset, similarly as the board has identified some high-level priorities for the agency for 2024, wanted to share with the commissioners a couple things that we're working on at the staff level. So number one, now that we've been in existence for, we'll be approaching 3 years, really looking at our internal processes, how we make those as efficient as possible, how we make sure we're serving the public as best we can. Something on the agenda today, provisional badging, I think is one item that falls into that category. Another that is top priority that we're actively working on is really streamlining and making our product reviews as efficient as possible so that those are getting reviewed for compliance, particularly with our manufacturing regs, our labeling regs or packaging regs, and then getting those out to market as soon as possible. So that is, two of the higher level priorities when it comes to process improvement. The other thing I wanted to note is, looking ahead at this market, not only to next year, but the years to come. And I think the edible rules that this board proposed that are now, making our way through that process include some really important provisions that really do that. So number one is referencing current good manufacturing practices in the Federal Register. That's an added level of consumer safety, accountability, and CGMP is in fact is required in every federal legalization bill that's been introduced. So it's something that will set New Jersey's market up to compete in decades to come. Not counting on federal legalization happening anytime soon, but nonetheless, we want to make sure businesses are here in New Jersey are prepared to compete whenever that opportunity arises. Along those lines, we're making progress here, and the market is making incredible progress. And I've said before that we are headed to $1 billion market. I've seen enough now in the data, and we'll be releasing more data in the coming weeks and months. But 2024 is the year this is the $1 billion market. This is the year that New Jersey does $1 billion in cannabis sales. So there will be more to come on that throughout the year, but I'm confident that we'll reach and surpass that milestone in calendar year 2024. Some of the people making that happen. One in particular is our Deputy Executive Director, Kelly Anderson-Thomas, and I'm going to pass it over to her to talk about some of the progress we've made both internally and some of the metrics we're tracking when it comes to licensing and things like that. So, Deputy Executive Director, take it away.
Thank you. Next slide, please, Dana. Oh, much appreciated, sir. I'd like to just kind of look back on how far we've come. I think that sometimes it's missed that the Cannabis Regulatory Commission started off as just the medicinal marijuana program under the Department of Health. And then in April of 2021, the state birthed this organization. I can think back to Jeff and my COVID days back at the Department of Health. And I remember him saying, he was leaving me in the dust, number one, because he had to go and find space and set up this commission with the help of the chair. But he was so excited about what the commission was going to become. He was so excited about how this would help him and help the board push forward our medicinal cannabis program. And if anyone in this room knows Jeff, they know that he is the subject matter expert when it comes to all things cannabis scientifically, and we appreciate that. The birth of the commission, 2021, and then the last 2.5 years, I think it's important to express that, one, we went from starting an agency with 6 individuals, the board that you see before you, and Jeff, I believe our director of comms, Tony Ann Blake, was our 7th employee, she likes to tell everyone. And over the course of 2.5 years, we've increased staff up to 73 and growing. If you have ever worked in the state, you would know that that is a hard task. Hiring, getting people in. I would not have been able to do it without my director of administration, Barry Simpkins, and staff in general. So, we went forward with onboarding and training staff, but during this process, I remember I onboarded in June, July of 2021. And Jeff and I sat down to talk about what the licensing process should look like. We looked at the statute, we wrote out the guidelines, and then he said, okay, we need a licensing system. Okay. So we procured a licensing system in 4.5 months. Again, if you've ever worked in state government, that is unheard of. Not only did we procure the licensing system, we did the business analysis, we did the development, and in December of 2021, mind you, the organization was created in April of 2021, we launched our application system and we started accepting our first licenses. This is all in under a year. We continued to build across the office, all of our systems, process development and implementation, procurement, more procurement, a lot more procurement. But I think what's important to realize is that through this, we developed the system requirements, the processes, and then Jeff, you entrusted me to onboard your staff and to implement key operational goals. And I think staff and the board, we have worked together to just build an industry like no other. And I am proud to walk into my office every day to work with such a group of dedicated individuals. So we did all of that in 2.5 years. In 2023, recreational cannabis sales hit just over 670,000. Million. Jeez. And then the 2023 medicinal cannabis sales reached over 99 million for the first 3 quarters of 2023. To date, we've had more than 2,500 applications submitted, and we recently celebrated more than 100 licensed dispensaries opening. I just want to thank the commission and the staff for all of the effort you continue to pour into this industry. I thank you, Jeff, for entrusting me, and I thank the staff for entrusting Jeff and I, and the board for entrusting Jeff and I. Thank you for coming into the space daily, where you've been part of some of the best collaboration I've ever seen in state government. We've truly fostered an environment that is productive, diverse, and inclusive, just like the market we have worked so hard to establish. One of the first things I remember in talking to Jeff about what he wanted the commission to look like from the staff perspective, and he said, I want diversity. If we're pushing for a market that is diverse, then the staff has to represent that. And I think anybody who walks into our offices, if you look around, even if you look around at the individuals sitting here today, we are one of the most diverse organizations within state government. And that's that's from the top down. And I think that's very important to also note here. But with all that said, let's get into why you're really here. So to date, we have, there have been 2,537 applications submitted. Of those, a little over 1,700 applications have been approved. 113 of those applications are under review in the Office of Licensing. 301 applications are pending resubmission following a cure, and 194 applications are under review in the Office of Compliance and Investigations. I think what we continue to show here is that we are moving through the applications. People who are applying, they're being heard, we're pushing things, the priority status is working, and so that's important. Updates on dispensary openings. We have 8 new recreational-only dispensaries that have opened since our last meeting, and an additional 2 medicinal. Now, as we continue to open and include more businesses in the market, I think it's important to also showcase that we're creating an inclusive market. Our ownership data continues to show that. I know this has always been, a touching point for Commissioner Barker, and I welcome the public to review our website for our last quarterly report that was posted last month, where you'll see the breakdown of majority ownership of businesses that have opened. I think when you reconcile race and ethnicity with majority ownership for annual awardees, this is our breakdown since our last report out. As it pertains to the minority-based majority ownership, we have 19% Asian, 18% Black or African American, 9% Hispanic or Latino, 1% American Indian or Alaska Native. I think it's also important to continue to tell the constituents of New Jersey, apply. If you are interested in getting into the cannabis industry, please submit your application. If you're having issues, the New Jersey Business Action Center is sponsoring with us a technical assistance program that can help walk you through the process. That will be launching soon. If you visit our website, there are detailed instructions on how to complete the application process. There are webinars. And also, if you send us an email or if you give us a call, we're always here for questions. It's important to note that we are still not only surpassing our benchmarks, but we're also passing Asian and Black census populations. We still have more to do within our Hispanic population. I know Director McWhite spoke on that in our last meeting, but we are increasing our outreach efforts. And I think, again, I want to just reinforce that we are surpassing and meeting federal ownership benchmarks across multiple industries across the nation. If we look at our diversely owned certification data, which is granted by the New Jersey Department of the Treasury's Division of Revenue and Enterprise Services, say that 5 times fast, we are at 46% minority owned and women and disabled veteran owned, which surpasses our 15% benchmark by more than 31%. Again, these are all wonderful stats. To date, for total recreational licenses approved, a little over 1,300 conditionals, 268 conditional to annual conversions, and 153 annuals. There are 66 expanded ATCs in the market today, and of those, 209 are operating licenses that have been issued. Of those awarded, 44% have majority ownership. So for today, there are 12 conditional applications up for consideration, 20 conditional to annual conversion applications, 5 annual applications, and 1 expanded ATC. I think it's also important to, again, touch on our medicinal cannabis program. To date, current patient enrollment numbers, total patients are a little over 85,000, caregivers a little over 5,000, and then doctors 1,533. That is the end of this section of the Executive Director's Report. I'd like to pass it over to our Director of Communications, Tony Ann Blake, for all things comms updates.
Good afternoon, everyone. I just wanted to share some work from the communications unit at the CRC. Our commitment is to reaching our audience where they are, across as many platforms as possible with as much information as possible. And our latest venture is High Points Podcast. It's available on Spotify and Pocket Cast and hopefully soon Google Podcasts. About 20 minutes, engaging conversation. Right now it's with internal staff. Our first episode is up with our Director of Diversity and Inclusion, Mr. Wesley McWhite III. And our second episode will be with our Chairwoman, Commissioner Wainu, and that will be posted on March the 1st. 20 minutes of your time, really easy to listen to, very informative. Go to the episode notes, click on there, there's even more information. So please join us. And if you have topics that you want to hear about, shoot us an email and we will get that done. Another thing that the comms unit is rolling out right now is our Safe Use campaign. And it was launched in October. It will run through September of 2014. And so far, we've had a lot of success by all metrics of advertising and public information campaigns. We are getting click-throughs on our online ads. We are getting, our billboards are along, there are 93 billboards up along 12 highways across the state, which we anticipate gets about 7 million. Could you go to the? Okay, so these are some examples of our Facebook and Instagram ads, and they speak to the topics that we've broached in this campaign. It is people who may have used cannabis in the past or trying it again, and we want them to be aware of potency, or if they're older, maybe talk to their doctors about interaction with medication. They're young people, so there's youth deterrence. We don't want anybody using before they turn 21. And for everybody else, it's safe storage and safe use, not using too much or too often. Go to the next one. And this YouTube ads, go to the next one. Display ads. All right, so as I mentioned before, 93 billboards up, 12 highways, highways along in 12 counties, and we've seen more than 17 million impressions. There are also interactive ads on websites where we're asking people basic information about where you can use, who can use, and then we're going to be using that metric to also see how much people have learned. So if you interacted with it at one point, and in a couple of months, we'll ask the same questions again to see if there's been change in education among the audience. These are some of the billboards that are along the highway. You may have seen those. And we also have posters in barbershops and beauty salons, because those are places people sit and are, have nothing to do but look on the walls during those times. And we're really working with some organizations on the ground to reach all kinds of communities. Many of our ads are in Spanish as well, and we have Immigrantly and Trenton Journal, Pushback, all of those where we have placed advertorials, articles, and ads to make sure that we're reaching as broad an audience as possible. And thank you. Please look out for the ads, interact with them, and let us know if they're reaching you.
Turn it back over to you.
Thank you both. And I have nothing else to add. Just tremendous job from everybody working on those projects. And back to you, Madam Chair.
Thank you, Director Brown, Deputy Anderson, and Director Blake. I want to open the floor for any questions from the board. I do have one quick question, Deputy Anderson, about the numbers that you shared. On one slide, I think it was right after you went over the detailed majority-owned data. The subsequent slide,
Diversity owned certification data?
after that one, at the end, it says there were 209 total operating licenses awarded or issued. Can you elaborate on that? It looked in the other, in the prior slides to be a total of 374, so I just want to make sure I understand what the 209 represents.
So the issue here is it should just say operating license issued, not just the awarded, so we wanted to be clear there. We will make that edit for the document that goes on the web.
Okay, all right, so 209 total annual licenses have been issued across the state. Okay, got it, thank you. Any questions from the board for the staff?
Yes, Madam Chair, thank you. So I have a couple of questions. And first of all, thank you to both Director Brown and Deputy Director Anderson for the summary, and thank you for all your help in the last 3 years. The first question is on the dispensary openings, and I'm very happy to know that there are 100 medical and recreational dispensaries open in 20 counties. And you and I had a discussion, Director Brown, that it is important to note that we need to keep an eye on the number of cultivation sites that are soon to start operating. I think that's crucial to ensure that there's enough supply for the dispensaries that are opening up. With that note, I would like to move into I want to thank the Director of Communications, Blake, for the summary here. One of the questions that I had for you is, how long would this campaign go for?
It's a year-long campaign, so it runs through September of this year. It kicked off in October, so it's October through the end of September.
Okay, thank you. And I think your outreach it's great, it's incredible, the impressions and the social media and the billboards. Education is key. So I know that we're educating consumers, parents. So I'm very happy to know that we're going to do this for a year long.
And thank you for your help with our Spanish translation.
You're welcome. I try. Thank you, Madam Chair.
Thank you, Commissioner Del Secoso. Are there any other questions from the board for the staff with respect to the Executive Director's report?
Just a brief question. I remember in the previous meeting, I had asked specifically about the businesses that were open and the majority representation of those businesses specifically. Does the staff have that?
Yes, we presented it last meeting. Wesley presented out on it, and it's posted on our website, but definitely I can forward it to you again if you need it.
Yeah, I didn't see it last meeting. I asked the question last meeting. So that's what I mean. I didn't see it last meting, and I haven't seen it on the website, but maybe I missed it.
Yes,
So-
I'll forward it to you. So Wesley did the quarterly report, if I'm not mistaken, and we did the oversight of majority ownership, and then we did additional 3 slides just on those that were awarded and opened. So I will forward that to you again.
Please, and I'll ascribe this in an email, but I think there may be a disconnect between what I'm asking for and what's being provided. So I do want that to be clearly understood. If we can reconcile that offline, I would greatly appreciate that.
Got it. Just a quick question. For my understanding, you would like the entities that are open, and you wanted to know of those open, which majority ownerships were black and brown minority ownership,
Black,
correct?
Hispanic, and indigenous specifically.
Yes, that's in the slides. I'll forward those to you.
And I have other requests that have still not been answered, and those have been memorialized. So I just want to start putting a pin on that. I'm hearing a lot of the data that we're saying, and it is great data, but it's not as specific and detailed as it could be to evidence and measure the impact that we're having and whether or not we're meeting our goals.
Completely understand. I think what we can do is we'll get that to you, but also we want to make sure that you understand the data that you're getting.
Absolutely.
That might be an issue also, that you don't understand what we've presented. So I'll get that over to you, and then we'll set up some time.
Thank you very much.
problem.
And I do understand, just to be clear, so
Okay.
thank you.
We'll make sure.
Thank you. Any additional questions from the board with respect to the Executive Director's report? Hearing none, Mr. Said, we can move on to the next agenda item.
Next item on the agenda are the committee reports.
Thank you. For today, we'll have the Permitting and Licensing Committee give a readout, and for this, I will turn it to the Chair of the committee, Commissioner Maria Del Secoso.
Thank you, Madam Chair. Quickly wanted to provide an update to my fellow commissioners and the public on the work that the Permitting and Licensing Committee has been working on in the last couple of months. So far, from November to January, we have issued 194 extensions. Next slide. For adult use awardees, they are approaching their operational deadline. We have 14th in the month of January, 22 for this month, and then 17 for the month of March. This slide right here shows 2 updates regarding the 2019 RFA. The first one is that there are 21 awardees with an upcoming expiration date. So we are highly encouraging any awardee to stay in constant communication with their field monitor and any staff at the CRC to ensure that you guys are going through the process. And the second update here is that from the overall awards, 2 of those awardees withdrew their consideration from the 2019 RFA. And the committee is recommending not to reissue those awards. There were many factors that the committee considered when making this recommendation. One of them is a lot of time has lapsed since those awards were issued, and I'm talking about October 2021. Reissuing those awards may require a new awardee to update a team of owners, principals, and managers, find new locations, or reapply for municipal approvals. And lastly, they were the highest scores applicants on the RFA. So we were to reissue these awards. It will go to the applicants that does not have the strong qualifications to properly serve registered patients that require the highest standards of care. And our last slide here, earlier the chair mentioned public engagement and industry assessment as priorities for this board. As part of those efforts, we're going to be soliciting feedback from you all on our application and licensing processes. The committee is going to convene a public hearing this spring to give the public an opportunity to weigh in on the current licensing process, understand what's working and what can be improved to reduce barriers to entry, hear ideas to make the processes more efficient. And we're going to be sharing those details with you soon via our social media or website, or both. And that concludes my report. Madam Chair, would you like to add anything?
Thank you, Commissioner Del Secoso. I think you've captured everything here. I just want to underscore for those businesses that are coming up on their operational deadline, those businesses that have for the adult use businesses, you have 1 year to get all of your construction or retrofitting done and request that final on-site inspection. If you are coming up on that deadline and you're running into issues or something is drawing out the amount of time that you need to become operational, please, please, please be in touch with your field monitor to let them know what's going on and submit a request for an extension so that the Permitting and Licensing Committee can properly document that you are having issues, that we've received communication, and we can respond to your extension request. That's all that I have to add, but thank you, Commissioner Del Secoso. Are there any questions from the board regarding the Permitting and Licensing Committee report? Hearing none, Mr. Said, we can move to the next item.
Next item on the agenda is the consideration of provisional badging.
Thank you. So with this, I will turn it over to Director Brown to provide summary remarks.
Thank you. So up for consideration by the Board of Commissioners is the resolution to authorize provisional badging for employees for cannabis business ID cards and codify that ability in the for ATC identification cards. We've all been hearing of the problems. One of the issues we have, the average time from request to issuance is 50 days right now for ATC ID cards. A lot of that is things that are outside of our control, outside of the purview of the CRC, but some is certainly within our purview. The statute for ATC ID cards gives us the ability to issue them provisionally for up to 90 days. And so the goal here is to start doing that again as quickly as possible. Next slide, please. Just some provisions here. So as noted on the previous slide, the provisional cards will be issued after 14 days have passed. So once you get fingerprint results, or once you get fingerprinted, you get a receipt for those fingerprints. Those can be submitted to CRC compliance staff. And once 14 days have elapsed, if we don't have the criminal history background check results back, then we will issue a provisional card. Applicants will also have to provide an attestation in accordance with the statute. This provisional status is only going to be offered to employees, so this is not going to apply to owners, principals, or managers. So anybody who is issued a provisional card will be working under the supervision of a fully carded and vetted employee. Being issued a provisional ID doesn't guarantee qualification. So, if a disqualifying conviction is uncovered, then you have to show evidence of rehabilitation and be considered by the board. Submitting a false attestation under this process could be grounds for disqualification or ineligibility. So we have guidance ready to go on these. We put into place system changes for ATC identification cards. Those are ready right now, and thanks to our registry team for getting those done quickly. It's going to take a little longer on the cannabis business ID card point, but those cards are being issued primarily within 14 days of licensure. So we're seeing those cards are primarily being issued to newly licensed businesses, and employees don't get carded until that business is open anyway. So those cards are being issued under that 14-day threshold from the point of licensure, but we will also be rolling that out as well. Guidance will come out as well as an overview of the process for the industry. But the real pain point right now is primarily with the ATC ID cards, and this action by the Board of Commissioners will help us address that. So recommend approving this resolution, and we are ready to start implementing shortly thereafter.
Thank you, Director Brown. Are there any questions from the board regarding the information provided? Hearing none, is there a motion on this matter?
Madam Chairwoman, I move that we approve this resolution for the provisional badging.
Thank you, Vice Chair. Is there a second?
Second.
Seconded by Commissioner Del Cid Coso. Is there any discussion on this motion to approve the resolution? I want to note that it's my understanding that we have very few individuals who are waiting more than 90 days to obtain their ATC identification card due to the background check results. So I'm optimistic that that there will be a very, very, very small world, if any, in which this 90-day period is not sufficient. But I'm also cognizant of the urgent need for businesses to be able to hire individuals, for people to start working, and happy that we are putting this together to make sure that it's clear that these individuals who do need to work can begin working within that, after 14 days if things have not, if a background check has not yet cleared just at that point. So I'm happy that we're doing this, because I think it is in the best interest of the employees and the businesses and the industry as a whole to make sure that we understand the impacts of our rules and our regulations, the impacts of our decisions here today. And so thank you to you, Director Brown, and the folks in the industry who reached out to the commission to alert us to this issue and work with us to better understand the circumstances that we needed to address. Any other discussion for this motion? Hearing none, Mr. Saeed, can you please call the vote?
Commissioner Barker?
Aye.
Commissioner Del Cid Coso?
Yes.
Commissioner Nash?
Yes.
Vice Chair Delgado?
Enthusiastically, yes.
Chairwoman Wainu?
Yes.
The motion passes. The next item on the agenda is the consideration of applications for name changes.
Thank you. Yes, we do have one, so we have two applications for name changes, one of which does include a recusal. So Commissioner Del Cid Coso is recused from matters concerning Clade 9 New Jersey, LLC, and as such, she will be stepping out of the room while the board considers this particular application, after which she will rejoin us, and then we'll continue with consideration of the other name change application. So with that, Director Brown, I will turn it over to you.
Thank you. So two name changes. We're doing the one first, which is Clade 9 New Jersey LLC to the QCC Group, and then I'll cover the second one when Commissioner Del Cid Coso rejoins us.
Is that it? Any other?
Yeah, I mean they've submitted, they're registered with the Division of Revenue Enterprise Services, submitted what they need to submit to us, and so they're recommended for approval for the name change.
Thank you. Any questions from the board regarding this particular application?
So we're going to take two 2 votes, right?
Correct. Mm-hmm.
Okay.
The first, any other questions? No? Okay. All right, hearing no other questions, is there a motion as it relates to Clade 9 New Jersey LLC?
So, Madam Chairwoman, I move that we approve application change to business name of adult use license awardee Clay 9 New Jersey LLC.
Moved by Vice Chair Delgado, is there a second?
Second.
Seconded by Commissioner Nash. Is there any discussion on this motion to approve the name change application for Clade 9 New Jersey LLC? Hearing no discussion, Mr. Said, can you please call the vote as it relates to Clade 9 New Jersey LLC?
Commissioner Barker,
Aye.
Commissioner Del Cid Coso is recused, Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes.
Thank you. So we'll now invite Commissioner Del Cid Coso to rejoin civilization. Great. And we'll continue with the next matter. Director Brown, the next name change
Thank you,
application.
Chairwoman. The next name change is Shy LLC to Midnight Greens LLC, and they've registered with Secretary of State, submitted all the necessary documentation to us, and recommended for approval.
Thank you. Any questions from the board regarding this name change application? Hearing none, is there a motion as it relates to Shy LLC?
Madam Chairwoman, I move the approval of application change to business name of adult use license awardee Shy LLC.
Moved by Vice Chair Delgado. Is there a second?
Second.
Seconded by Commissioner Del Cid Coso. Is there any discussion on this motion to approve the application to change the business name? Hearing none, Mr. Said, can you please call the vote?
Commissioner Barker,
Aye.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes. The next item on the agenda is the consideration of applications for ownership changes.
Thank you. I will turn it over to Director Brown for a summary of the application submitted for an ownership change.
Thank you, Chairwoman Wenu. So today, up for consideration is an ownership change related to Harmony Foundation. Harmony Foundation is a distressed alternative treatment center. They've been under the control of a court-appointed custodian for some time now. That court-appointed custodian has found and negotiated a sale to bring in new management to that company. That proposed sale was reviewed by the court and approved, and is now up for consideration by the CRC. The entity that would take control of Harmony, illicit cannabis, has complied with background investigation, submitted everything they needed to submit, undergone the criminal background checks required by statute and by regs, and this transfer is recommended for approval by the Board of Commissioners.
Thank you. Director Brown, are there any questions from the board regarding the information provided? Hearing none, I will ask for a motion on this matter.
Madam Chairwoman, I moved approving the transfer of ownership of Harmony Foundation of New Jersey, Inc. to Illicit Cannabis New Jersey LLC.
Moved by Vice Chair Delgado. Is there a second?
Second.
Seconded by Commissioner Del Cid Coso. Is there any discussion on this motion to approve the transfer of ownership? Hearing no discussion, Mr. Said, can you please call the vote?
Commissioner Barker,
Nay.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes. The next item for consideration is the adult use cannabis business conditional license applications.
Director Brown, I will turn it over to you to describe the applications received.
Thank you, Chairwoman. And as we go through this section, we're going to ping pong kind of back and forth between approvals and denials. But at the outset, I'm going to run through the application review process. It's obviously included in the recommendation report, but just for the record. But then I'll just cover the specific application numbers in each cohort and the specifics related to the denials. So there's 12 conditional licenses, I think 20 conversions, and 4 annuals up for consideration for approval. Those applications, they've all undergone priority assignment based on the type of application. That priority has been verified. The applications have been reviewed for completeness to ensure they have everything that they need. They've been scored in accordance with the notice of the application acceptance. They've all scored sufficiently high to move forward. Then they all undergo various levels of qualification, limitations, financial management agreement review. That is much more in-depth for annuals and conversions versus conditionals. Annuals and conversions then undergo qualification review, which is probity as well as criminal history background checks. Finally, our staff conducts quality control, and all of these applications are recommended for approval. The first cohort are the conditionals. There are 12 conditional license applications that have gone through that review process and are recommended for approval.
Thank you. Are there any questions from the board? Hearing none, is there a motion on this matter pertaining to the conditional license applications?
Madam Chair, I move that we approve the conditional license applications.
I second.
Moved by Commissioner Barker and seconded by Vice Chair Delgado. Is there any discussion on this motion to approve the conditional license applications? Hearing none, Mr. Saeed, can you please call the vote?
Commissioner Barker,
Aye.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wainu.
Yes.
The motion passes. The next item up for consideration is the adult use cannabis business conditional license application denials.
Thank you. Director Brown?
So for these denials, and thank you, Chairwoman, there are 7 applications recommended for denial, all for non-payment of application approval fees or licensing fees. These are applications for which they've been noticed several times of the need to pay their fees in order to get issued a license and move forward. Despite those notices, they have not paid and therefore are recommended for denial here. If the applicants change their mind, they can refile a conditional license application and go through the process once again. But all these businesses have been duly noticed the need to pay the fees and have not, and therefore are recommended for denial.
Thank you. Are there any questions from the board? I do hope that these businesses resubmit an application and continue see the process through to becoming operational. If there are no questions regarding the conditional license application denials, I will ask for a motion on this matter.
Motioned.
Moved by Commissioner Nash to approve, sorry,
I second. I second.
sorry, 1 second. I'm sorry, I don't have the resolution on this one in front of me. Thank you. All right, so, thank you, Commissioner Del Cid. So the motion is to approve the resolution to deny the conditional license applications. And Vice Chair Delgado, you are seconding that
I am
motion?
seconding, yes.
All right, seconded by Vice Chair Delgado. Is there any discussion on this motion? Hearing none, Mr. Said, can you please call the vote?
Commissioner Barker,
Abstain.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes. Next item up for consideration is the adult use cannabis business conversion license applications.
Thank you. Director Brown.
Thank you, Chairwoman. We have 20 conditional to annual conversion licenses up for consideration. They've all gone through the process that I outlined at the beginning of this section and are recommended for approval.
Thank you. Are there any questions from the board regarding the conditional to annual conversion applications? Hearing none, is there a motion on this matter?
Madam Chair, I move to consider the applications to convert from conditional to annual Class 1, Class 2, and Class 5 retail licenses.
Moved by Commissioner Del Cid Coso. Is there a second?
I second.
Seconded by Vice Chair Delgado. Is there any discussion on this motion? Hearing none, Mr. Said, can you please call the vote?
Commissioner Barker,
Aye.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes. Next item up for consideration is the adult use cannabis business conversion license application denials.
Thank you. Director Brown?
Thank you, Chairwoman. Was hoping to not see one of these, but we have one application who, again, similar to the conditionals, haven't paid the license approval fees, and therefore, have been noticed that they need to make those payments, and given many opportunities to do so. So we are recommending them for denial. Same with the conditionals. If their situation changes, they are welcome to reapply and move through the process again.
Thank you. I share the sentiment on lamenting the fact that we have one of these, but it is what it is, and our process is our process. So hopefully, businesses will pay their fees so that they can move forward in the process. Are there any questions from the board regarding this conversion application denial? All right. Hearing no questions, is there a motion on this matter?
Motioned.
Second.
Moved by Commissioner Nash to deny the conditional license application for this entity, seconded by Vice Chair Delgado. Is there any discussion on this motion to deny the application? Hearing no discussion, Mr. Said, can you please call the vote?
Commissioner Barker,
Abstain.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes. The next item up for consideration is the adult use cannabis business annual license applications.
Thank you. Director Brown, I'll turn it over to you.
Thank you, Chairwoman. So we have 4 annual licenses up for consideration. I will note versus what was listed on the website before the meeting, 2893 has been removed from consideration. So the other 4 are still under consideration here. They all went through our licensure process as outlined at the beginning of this section of resolutions, and they're all recommended for approval by the Board of Commissioners.
Thank you. Are there any questions from the board? Hearing no questions, is there a motion on this matter?
Just a brief statement, not a question.
Okay,
Is that okay?
sure.
I'm very concerned. And so, and it pains me to be here during Black History Month to share through my purview from what I see. Our cannabis industry in New Jersey is shaping up to be dominated by businesses whose majority ownership does not reflect those that have been most harmed by the failed war on drugs, particularly our Black, our Indigenous, and our Hispanic people and communities. We need to focus on this more. We need to provide more in-depth data to measure the impact we're having and to see if we're meeting our goals. We didn't legalize this because it's business as usual. We did not legalize it because Black businesses or Hispanic businesses or Indigenous businesses were failing. We did this to address the harms that the failed war on drugs caused. And so when I see a state right next door that may have half as many businesses open, but probably the same amount of businesses open by Black and Hispanic and Indigenous people, that is concerning. And so I'm hoping that our board can consider the request to focus on this issue more. And I hope that you, the people, demand it from us and demand it from the New Jersey leadership. We just heard that there's going to be $1 billion realized in 2024. And I'm hoping that Black and Indigenous and Hispanic people, communities, and cannabis businesses significantly benefit. And it's incumbent upon all of us in this room and those outside the room and those watching to please join us so that the right thing can be done. It's always the right time to do the right thing. I turn it back to you, Madam Chair.
Thank you, Commissioner Barker. Is there a motion on the matter as it relates to annual license applications?
Madam Chairwoman, I move that we approve the consideration of annual license application for the 4 applicants listed in the resolution.
Sorry. Moved by Vice Chair Delgado to approve the annual license applications for cannabis businesses. Commissioner Del Coso, was there something that?
Yeah, just a brief statement, and that's okay with you, just in response to Commissioner Barker's comment.
I see. If you don't mind, we have no motion that has been seconded yet, but when we do open for discussion on a motion that has been presented, happy to turn to you, Commissioner Del Coso, to offer comments.
That's fine with me.
So Vice Chair Delgado has moved to approve the 4 annual license applications. Is there a second?
Second.
Seconded by Commissioner Del Coso. Is there any discussion on this motion?
Madam Chair, may I have the floor?
Commissioner Nash, I will turn to you. I will first give Commissioner Del Coso the floor to share her thoughts, and then we'll turn over to Commissioner Nash.
Thank you, Madam Chair. I as a Latina woman, I take this very seriously, Commissioner Barker. The numbers that Wesley has presented, Director McWhite has presented to us, show progress, and it's not going to change overnight, right? It's going to take time. It's going to take efforts, both by the applicants and by the state. We are working very hard to provide those resources, working with our partners at CBA and also at EDA to hopefully lower the barriers to entry. And that's our goal. And I think that's something that we can all agree on as the board, that it is our priority to make sure that we have representation in the ownership. And that goes to, Blacks, Latinos, Indigenous. So, with all due respect, I understand that you want data and more details on the information that we're getting from staff. But nonetheless, it is a priority of mine, a personal one, to make sure that, we do have demographics that represent this industry. And I'll leave it at that. Thank you.
Thank you. Thank you, Commissioner Del Cid. I'll kick it over to Commissioner Nash, and then we can go back to Commissioner Barker.
So during my review of applications in general, I have identified certain individuals who are submitting consultant or vendor contractor agreements, which are not subject to the statutory cap. In my opinion, we need to conduct more probity on such agreements to determine whether they are actually management service contractors, which would be subject to the 5-limit cap. Commissioners' oversight in this area is crucial to promoting a fair and equitable industry. I cede back to you.
Thank you, Commissioner Nash. Commissioner Barker.
Just very briefly, in case it's lost on this board, I'm Black and Latino. My mom is Dominican. So that is not lost on me either. But when we talk about time and effort, we're on year 3. And the benefit that we had is that we were able to learn from other states. And in addition to that, we communicated to the public and ensured that we were going to start as a foundation leading with equity and diversity. And so I'm here to say we're approaching year 3. We can and should be willing to do better.
Thank you, Commissioner Barker. Any further discussion on this motion? Hearing no additional discussion, Mr. Said, can you please call the vote?
Commissioner Barker,
Abstain.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes. The next item up for consideration is the adult use cannabis business annual license renewals.
Director Brown, I turn the floor to you.
Thank you, Chairwoman. So we have 3 renewals, all block dispensary. The addresses are there on the screen. So this is for adult use annual license renewals. They have submitted renewal applications, submitted everything required by our regulations for that renewal. They are seeking renewal, continue to be in compliance with patient access provisions, both in statute and reg and FADs, and so they are recommended for renewal.
Thank you. Are there any questions from the board? None. Is there a motion on this matter?
Madam Chairwoman, I move that we approve the renewal of adult use cannabis business license for expanded treatment center block dispensary LLC for their 3 locations.
Thank you. Is there a second?
Second.
Seconded by Commissioner Del Cid Coso. Is there any discussion on this motion to approve the renewal? I just want to note that again, I did note in the chair's report that part of the priorities for the board and for the committees will be to enhance the renewal process for licensing and permitting. So I look forward to strengthening our renewal process for applicants that are coming up on their annual license expiration. Is there any other discussion? Hearing none, Mr. Said, can you please call the vote?
Commissioner Barker,
Abstain.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wenu.
Yes.
The motion passes. The next item up for consideration are the expanded alternative treatment center certifications.
Thank you. Director Brown, I'll turn it over to you.
Thank you, Chairwoman. We have two expanded ATC certifications up for consideration. So I mentioned with the ownership change that Harmony Foundation was a distressed alternative treatment center. They had since ceased operations at their dispensary location in Secaucus. The remaining operations are at a facility in Lafayette. They have a cultivation and manufacturing there, and they are seeking expansion. In reviewing against the statutory requirements, their, production capacity, what they're doing wholesale, they are, they meet the standard for expansion. They have municipal approval. They have those factors that are required by our ATC expansion criteria, and so therefore they're both recommended for approval, both for a Class 1 manufacturer and a Class 1 cultivator and Class 2 manufacturer license.
Thank you, Director Brown. Are there any questions from the board? I just have one question. So I believe the materials list the ATC for this matter as Illicit Cannabis New Jersey, but Illicit owns Harmony. Did Harmony?
It's Harmony.
Foundation of New Jersey would
Yep.
still be the.
It's Harmony Foundation of New Jersey, that's correct.
So Harmony Foundation is still the ATC name. It's just that Illicit has now would be.
Yes, correct.
Will own Harmony.
Yeah, once that is effectuated, Illicit would be the owners of Harmony Foundation or control, they would have control of Harmony Foundation of New Jersey.
Correct, okay. So I just want to make sure that that name correction needs to be made on the resolution that we have.
Yeah, we'll make that correction, and we'll also make the correction on the slides before they're published.
Okay, great, perfect, thank you.
So just to get it.
Vice Chair, yes.
The motion is for Harmony?
Correct,
Okay, gotcha.
correct. Well, if there is a motion, there hasn't been a motion yet. Right. Are there any other questions from the board for Director Brown? All right. Hearing none, is there a motion on this matter?
Madam Chair, I'd like to move resolution on the acceptance of certification for ATC Harmony to expand operations to the adult use, personal use cannabis market.
Thank you.
And I second.
Seconded by Vice Chair Delgado. Is there any discussion on this motion to approve acceptance of the certification for Harmony Foundation? Hearing no discussion, Mr. Said, can you please call the vote?
Commissioner Barker,
Nay.
Commissioner Del Cid Coso,
Yes.
Commissioner Nash,
Yes.
Vice Chair Delgado,
Yes.
Chairwoman Wainu.
Yes.
The motion passes. The next item on the agenda is we have the open public comment period.
Thank you. Now, as we remind folks, at every board meeting, members of the public can submit their comments during and after this meeting in writing via our website, nj.gov/cannabis/meetings. The deadline for submitting written comments for today's board meeting is 5 o'clock tomorrow, Friday, February 16th. Written comments will be shared with the commission members and will be made public. Speakers today will be limited to 3 minutes. Mr. Said will call out the names of our registered speakers. When you hear a name called, please come forward. There is a microphone at the table here, so just tap the button that says push until you see that green light, and then you may begin. Mr. Said, can you please call the first speakers?
Thank you, Chairwoman. As a reminder, public speakers during this afternoon's public comment period will be limited to 3 minutes. Please be respectful and concise during your comments. All right, so the first 3 names that I'm going to call up are David Fetter, Samuel Reichbart, and Susan Sciaretto. If you're in the room. Just please state your name on the microphone.
Hi, my name is Samuel Reichbart. I'm here to speak to you guys about a couple of things today. Most was actually asking the commission to consider a patient advisory board, so I'm very happy to hear that you guys are.
Oh, excuse me, I'm so
important.
sorry. Oh, yes, thank you. The microphone had cut off for a second, so you're fine. You're good.
sorry.
Continue.
You can move it closer to yourself if you want. You can move it to you. Yeah, there you go.
I do encourage you guys, though, to reach out to patients as soon as possible and not wait until we're considering new rules. There are actually current rules and regulations that are taking a toll specifically on medical patients, and we hope to get those things figured out as soon as possible because that's why you guys are continuing to see patient numbers drop off. Unfortunately, it's easier to walk in as a recreational patient and a recreational customer. I can buy as much as I want typically. We're only limited per transaction, whereas patients are limited to 3 ounces a month. Why would we be patients? It quite literally does not make sense. On top of that, we're denied from using our medicine in hospitals, which was supposed to be fixed by the 2019 J. Koenig Compassionate Use Medical Cannabis Act. Unfortunately, those rules have failed to be implemented, and friends like mine who struggle with seizures, which she would like to be here today, but she couldn't because lights like these and improper access to meds and no access to hospital care has left her struggling at home. I worry about her all the time. She could quite literally pass away at any moment from any seizure she has, and she can't go to the hospital because if she were to go to the hospital, lights like these would cause her to have a seizure, and the only thing that can stop them is tinctures that she has gone out of her way to create herself because, again, she doesn't have access to the proper meds in this state. And those tinctures would not be able to be administered to her by a doctor. Her family would be kicked out of the hospital for trying. They would be forced to watch her have a seizure in that bed until she died. All because we haven't implemented a 5-year-old law now to give patients access to medicine. It doesn't make sense to me. And we even spoke today about not issuing more medical licenses. Why aren't we issuing those medical licenses? Patients don't have access to medicine. We haven't had access to medicine for years. I stopped using medical cannabis in New Jersey in 2018 when I started seeing pictures of Curaleaf growing moldy weed, Harmony with dirty grow rooms. All of these places, they're all horrible. And nothing has changed. It's unfortunate. I wish I could say something better. I don't know what else to say. I don't know how many more times patients can sit up here, how long we can continue to ask for the provisions that we need. I would really like to discuss some of this stuff with you guys privately. I've gone through the processes of requesting a meeting, and I've not gotten any answers back. So, thank you for letting me speak today.
The next 3 on the list are Martha Figaro, Michael John Odenwald, and Brian Naranja.
Good afternoon. My name is Mike Odenwald, founder and CEO of Green Growth Advisors, doing business as Local Flower Farms. My company is built and organized and funded as an MSC, Management Services Contractor, just mentioned, to help other companies get in to operate their licenses. We're an incubator of sorts. I pivoted from software and technology after 30 years in New Jersey cannabis. This is the first time I've worn this suit in 3 years. I've helped 20 startups with strategy, most recently measuring risk. Go figure. I share this because I typically look to create a playbook. In this case, the state has given me, all of us, a large playbook to analyze. I've collected and organized a lot of data. After a year of analysis, I've confirmed a bunch of things, all of which I want to share more with you in a follow-up meeting. Thanks in advance for that. In the interim, one observation in particular I want to call to your attention is micro-business cultivation. My team is 95% confident that 6 licenses were approved in all of 2023. 6. None of them in an impact zone. Yet a majority of the reason we are all here is to help maintain and revitalize impact zones across the state. We then went on to prove with a high degree of confidence that a standalone micro-businesses is not an economically viable business. Getting a harvest to a shelf is an expensive hobby at best. I have a solution to change that, one that puts New Jersey residents at the forefront of entrepreneurship and cultivation. White, Black, Hispanic, Indigenous, woman-owned, disabled vets, all profiles. People smarter than me say that the state needs about 1 million square feet of modern indoor cultivation canopy to feed the New Jersey market. We're already north of close to 500,000 square feet, as my team can see. 90% of that is in warehouses on highways. What's missing in the market? Micro-business cultivation and products that stem, pun, from the sun. Seed, soil, sun in micro-sized greenhouses, rural and urban communities alike. My model helps open up another license type for all New Jersey residents beyond a retail dispensary. When this happens, New Jersey residents can create another grow local, buy local market for sun-grown products in the state, in locally owned dispensaries. This is a proactive economic development plan for the municipalities who take an interest to listen to my plan. My model is built to create 50 new small businesses and over 1,000 jobs, unionized jobs, many of them, to make the first dent in big business cultivation dominance. And my model makes compliance around micro-business cultivation possible. My ask today is for a follow-up with some of you to share the data, a lot of data, and discuss some ways for the state to elevate the opportunities for micro-business cultivation for New Jersey residents. Thank you very much.
The next 3 speakers on the list are Eric Iferga, John Marchetti, and Miriam Cure.
Hi, my name is Miriam Kure. I'm Amina Kure. Our company is Indicure. So sorry, we're really nervous. We're not used to public speaking, so just bear with us for 3 minutes. So 6, because there's 2 of us. Okay, so yeah. Yeah. Okay. So the first thing we want to say is thank you for believing in us. We are your equity. We are 2-time Iraqi combat veterans, we're minorities, we're females, and we really appreciate the fact that you guys saved licenses for us. Sorry. I want to start by saying when we first started this journey, it was like 3 years ago, we went to like the Cannabis Entrepreneur Conference, and we actually paid a consultant to tell us that
he said that
nobody would save a license. Yeah. He said nobody would give you guys a license, that
to wait 2 years and then see how everything works. And we were like, you know what?
Forget him. We're just gonna do, sorry, I'm really sorry. Forget him. We're gonna go for our license, and we did, and you guys believed in us, and you guys gave us the license. Thank you very much.
Thank you very much. Also, like, we honestly want to like bridge the gap between like, I guess, veterans and the industry and the community, because there are a lot of issues with veterans wanting to use cannabis, but
the stigma behind it, like at first, like we became medical recipients because we were like not in a good place for a really long time, and we had a battle buddy that like introduced us to like the medical marijuana, and it's been like
helped us a lot. So that's what pushed us to like try to get into the industry.
And we initially really just wanted to grow because like we're like gardeners by trade. Like that's all we do is grow. Like that's like
We grow plants.
Like gardening. Sorry, hostas, dahlias, like flowers. Yeah. So like that's like that really helps us like with our anxiety and everything. And we realized that we wouldn't be able to get on the cultivating side because we wouldn't be able to afford to get in it that way. So that's what prompted us to go the dispensary side, so that the dispensary would help us be able to get into the grow and manufacturing.
Oh, we also want to thank and Inspector Ryan, because he's always communicating with us.
And letting us, I don't know, is he here? Okay, so thank you, Inspector Ryan, yeah, he's always opening up lines of communications, and also Wesley, thank you, Director Wesley.
White, because we
Yeah.
were in a kind of a bad place, and we emailed and reached out, and he actually
Guided us. The reason, like, right now, we own 100% of, well, she owns 100% of our company, but what's hers is mine, what's mine is hers, so 50-50. And she owns 100% of the company right now. Like, it's ours. Our build-out's gonna start within, like, next week, so we're really excited.
Yeah, and
to-
also another reason why we're able to we're here being talking and owning the amount of our company is because of
Cheryl Murray Powell,
Leo Bridgewater,
Tahir Johnson, and the Dank Duchess.
But they've been guiding us
throughout the whole thing. Like, they
everything.
saved us
'Cause
from
we don't know anything about business. We're
LPNs by trade,
Yeah, we
so
were
we just
going to
came
school to get
over.
our RN, and then Murphy legalized, and we were like, let's just try it, and
Yeah,
we did,
and we're here.
We're here, so thank you. And
That's
that's
it.
really it. Well, we didn't use all of it.
Oh, and then, I'm sorry, if we're not here to talk to everybody afterwards, like, my daughter has a basketball game and we're coming from North Jersey, so we might have to leave. We would love to speak to everyone, but just in case, we're not
Where's your
here.
location?
Somerset,
Franklin.
Indicure, Franklin Township.
If I can let you speak for another 6 minutes, but I can't.
Thank
Thank
you,
everyone.
thank you.
Have a great day.
The next three on the list are Carlos Almanzar, Tahir Johnson, and Mariah Williams.
All righty. Hello, commissioners. It's an honor to be here today. My name is Tahir Johnson. I'm the founder and CEO of Simply Pure Trenton. We have a annual adult use cannabis dispensary license close down the road in Ewan Township, and we were also thankful to be granted our conditional cultivation license today. Today, I'm here to talk about Rule 6.8G, which restricts cannabis business owners from having ownership in more than one licensed entity. And the reason for that is because I believe that it causes restrictions in allowing businesses to be able to grow. In my case, like I said, I was awarded the cultivation license today for Simply Pure Trenton, but if I had my way, it would have been good to be able to form a separate entity to own that business rather than it be Simply Pure Trenton. Why is that important? Because I raised a significant amount of equity capital to fund the dispensary, and now that I have to try to raise funds to be able to fund the cultivation, there's not much left to give to be able to fund the business. So when you look at how that causes restrictions, being able to have a separate entity that you can raise capital for will allow those business opportunities to be able to grow. So I think it's an unintended consequence of being limited to one entity ownership. And when you look at the larger companies, I don't believe they have that that same restriction. So again, I think that it has, like I said, unintended consequences that limit the ability for businesses to be able to raise capital, to be able to become vertically integrated and have multiple business lines, especially if we want the minority and social equity businesses to be able to grow and expand into other lines of businesses if they already have one business open. And that was just the point that I wanted to speak about today. Thank you.
The next three names on the list are Walter Iwaki, John De Los Santos, and David Little. Sure, go ahead. And then you can go.
Got it. Good afternoon, Commission members. My name is John De Los Santos, founder and CEO of Royal Roll LLC, holding conditional license number RE42. I am a social equity minority-owned impact zone applicant, and I'm here to bring some issues to the commission over my municipality. I am the first applicant to apply to my municipality, which is Paterson, New Jersey. This is going back to May 8th, 2023, and I have been proactive in contacting the CRC with my issue. It's just gotten to a point where it's getting a little bit, to use proper words, it's too much to have faith in this municipality anymore. As a social equity applicant, and I'll be straightforward, I've been bleeding out $20,000 of rent a month for my dispensary. In that time, I've been able to obtain resolutions for manufacturing and cultivation, but it is tough to move forward with those licenses when you're held up with your dispensary. And this municipality has caused me more than 2 groups that I've been working with that have been willing to come to the table and help fund this venture. They issued 3 resolutions in July 18th of 2023 without regards to their own ordinance and disregarding their zoning and ordinance for the distance between places of worships and schools. The 3 resolutions they issued do not adhere at all. And their response was to add more licenses. I was told on record during a meeting, wait, we'll add more licenses and we'll issue you a resolution. That's 8 months now. I don't know if the CRC can step in at all. I know you have been clear on the role of municipalities and what the state can do. But I also know that the regulations state that you will not approve any resolution that does not adhere to its city ordinance. So it's a very clear issue we're having here, and it's being overlooked for some reason. Thank you.
Thank you for having me. My name is Dave Little. I am the managing member of Inclusion Gourmet, which is a cannabis processor. Thank you for my license a couple months ago. I'm very grateful. I'd like to talk about processing. We've heard a gentleman talk about cultivation, and a couple people talk about retail. We're a processor. So Inclusion Gourmet and our Jersey Cannabis brand is an FDA FSMA registered, GMP certified, 30-year confectionery lab with nutraceutical background with a specialty in chocolate. Okay. Having always been in New Jersey, we also have 30 years of FDA and New Jersey Health Department inspections. This looks pretty familiar, Mr. Brown. This is from the year 2000. So we've got a lot of experience here. Coincidentally, February is National Chocolate Month and Valentine's Day. So let's discuss chocolate and processing. Okay. I actually brought a sample, and I want to explain briefly what's involved in processing, because there are very few processors, and it should be understood what's involved in the processing format. So let's start with this. Right now, there are only 4 processors on the website listed, and I believe we're only one of 2 that specialize in edibles. Quick explanation of how we make our product. We start with about 10 of these, which is 11 pounds or 5,000 grams. And then we take oil. I obviously couldn't bring oil, but this is approximately 150 grams, just to give you an idea. And we use very expensive and sophisticated machinery. With our experience, we're able to homogenize, get independent lab results. These are independent lab results, so everybody can have a look at them. And we create a 3-gram finished piece, which is, every day we do this, we think it's an absolute miracle when you realize that we can correctly homogenize into this piece 10 milligrams, which came from 200 grams. Really amazing. It's very involved, and it takes a lot of expertise is what I'm trying to get at. I don't know if the commission has seen this, but there is complimentary press on the commission and on ourselves, I might add, in New Jersey Monthly's February issue. I was told I can't give one out, but I will attach it in my comments. It actually says, "Let them eat chocolate." Very funny. And it talks about our experience and, of course, what we've done. So to cut to the chase, I'd like to make some simple suggestions for the CRC based on our experience. First, I think we should have a faster product approval process. We talked about that briefly before. We know that retail cultivating can really help us along, but it should be modeled off of what's existing in the alcohol, beverage, and control industry. Okay, this is very simple. They have a thing that's called the POSSE system. It's online. If we could implement this, it would really expand and make it a lot easier for processors. I know we do a lot of stuff online in this commission, so this would really be something worthwhile. I know we also talked about the need for quicker onboarding. I work in the Passaic Community College culinary program and with interns, so that would be very helpful. I'd like to see if we can share some stats of the actual people who have licenses. That would help all of us. I know, Mr. McWhite, we talked about that briefly.
David, I'm sorry, the time is up.
And my time is up. I'm running out of time, so I won't give you the fourth one.
If you could just wrap up your
All
comments.
right, I have one last comment. I encourage the creation of a CRC ombudsman who works directly with private independent licensees to assist their interactions with the CRC. Similar to the Business Action Center of New Jersey, we need a focused contact who can go to bat on our behalf. Thank you for your time. I'll clean up now.
Sir, could you leave that 11-pound chocolate block?
I'm not allowed to give you samples, I was told, right?
I was kidding.
But you're more than welcome to visit our factory and understand processing. We are in Fairfield, New Jersey. The same factory we've been in for 25 years.
The next three names on the list are Abigail Kalmbach, Marcel Rodriguez, and Chris Goldstein.
Hi, my name is Abigail Kalmbach, and I come before you as a medical cannabis patient and a member of the Coalition for Medical Marijuana New Jersey, CMMNJ, and a scientist. I'm here to talk about two things: the need to increase accuracy of laboratory testing of cannabis for safety, and the need to finally implement three last provisions of the J. Koenig Compassionate Care Act that haven't been implemented. Good afternoon, everybody. Thank you for the work that you've done to create a robust and equitable market. However, one of the biggest advantages of a regulated cannabis market for patients and consumers is accuracy of or assurance that the products we have passed rigorous safety tests on representative samples from each batch of flower grown or product manufactured. I'm here today to urge the Commission to increase the frequency of testing cannabis flower to ensure representative and effective testing, which will ensure increased accuracy for cannabinoid and terpene profiles, as well as catching any contaminants that may be present. The easiest way to increase accuracy of testing is to reduce batch size. At New Jersey's current batch size of 100 pounds, our state is double the net size of any other legal market and nearly 7 times the size of the most common state batch size. What's most striking, however, is that while New Jersey has literally copied Maryland's testing regulations during this interim period of writing our own, we have made one change. Instead of the 10-pound batch sizes that Maryland has, we have 100-pound batch sizes. The huge batch sizes in our state make a mockery of any assumption that representative samples can be accurately reflected across the entire batch. It gives financial advantage to larger cultivators because they don't have to test as frequently as smaller cultivators. And most importantly, the huge batch sizes hurt the patients and consumers as moldy and toxic products cannot accurately be detected. It is unfair to push the risk of mold and toxins onto patients and consumers as we cannot visually inspect the product for mold prior to use. Switching gears more fully to patients, I want to ask the Commission's members what the timeline for fully implementing provisions of the J. Koenig Compassionate Care Act. Patients are still waiting for access to their cannabis medicines in hospitals, like Samuel mentioned earlier today. I know patients who have risked their lives by not seeking medical treatment because they're unable to continue use of their cannabis-based seizure medicines while in the hospital. This act was passed years ago, and since recreational cannabis came on the scene, it seems like everyone has washed their hands of setting up the institutional caregivers, dosing and administration guidelines, and educational programs for doctors and nurses. These educational programs are particularly needed because less than 2% of doctors in New Jersey are licensed to prescribe cannabis medicine, perhaps because they lack educational material and institutional support to understand how cannabis can be medicines and prescribe it to patients. Please advise on how we can implement these important provisions so that medical cannabis patients can access their medicines from informed practitioners. Thank you for your time today.
Hi there. Good afternoon, Commission. Thank you for allowing me to speak. God bless you all. Good afternoon. My name is Marcel Rodriguez, the owner and founder of We Shop LLC in Somerset, New Jersey. Since 2019, I've been an entrepreneur, experiencing rapid growth with my first retail business in Woodbridge Mall. Fortunately, the success allowed me to open up another location in East Brunswick Mall shortly after. Both locations were thriving. The opportunities opened by the Hemp Farming Act of 2018 enabled me to offer a high-quality product. However, like many small businesses and business owners, COVID-19 dealt a devastating blow. I was forced to close my doors, losing inventory and the momentum I had built. Despite these setbacks, my strong relationship with both mall locations allowed me to recover some inventory and begin rebuilding with limited funds. Giving up was never an option. Being an entrepreneur is ingrained in me. My innate skills and the support of a welcoming community propelled me forward. Finding a building available for immediate occupancy, I seized the opportunity and poured everything into making it work. Though I lost my apartment, had my car repoed, even lost my place and had to sleep in hotels with my kids, I remained determined and passionate. Since I was 10 years old, I've been doing this, so I wasn't about to vanish. As a cannabis patient myself, I knew how to excel in the role and offer exceptional service to fellow patients and fellow people in my community. I always said, why not me? Became my driving force. Equipped with extensive industry knowledge and a deep understanding of customer needs, I earned all necessary certificates and opened my doors in Somerset in June 2020. Even at the height of the pandemic, I took a calculated risk, believing in myself when few did. When the CRC application window opened up in 2021, I immediately filled out the forms with my lawyer through reviews and evaluating. Since then, I've eagerly awaited the CRC's response. Having received neither an approval or a denial, my legal counsel clarified that my application is undergoing additional reviews to confirm my minority business ownership status. I am here today to introduce myself to the committee, provide any further information required, and confidently prove that I am indeed a minority business owner. So hello and good afternoon to you guys. So yeah, that's it. So God bless you, and I await your answers.
Yep. Can you pass this down? Thanks. I have a visual aid today, too. Hey, good afternoon. My name is Chris Goldstein. I'm a cannabis consumer advocate with NORML. I've been working on this for more than 25 years. In fact, next week is the 3rd anniversary of us passing the adult use laws. It was a momentous occasion. And while you're focusing on 100 dispensaries being opened, we had another number that we were using back in the day, which was a really hard number to talk about. That was 100 people getting arrested for marijuana possession every single day in the state of New Jersey. That's what stopped 3 years ago. That means today, more than 100,000 people have been prevented from having a police encounter over a small amount of marijuana. And that's why it's tough for me to come here today, and I hope the communication staff will listen to this, because there have been some seriously tone-deaf social media posts from you guys. You're asking people to turn in unlicensed medical marijuana sellers out there and marijuana sellers. Call the cops if you see an unlicensed seller. Do you guys think that all the terrible enforcement problems have stopped? Do you think the police have completely changed how they treat people who are selling marijuana? They haven't. Don't tell them to call the police. Tell them to call you. I would like to see a hotline by NJCRC to answer calls about unlicensed marijuana sellers so that you can go out with a strike team, get them a permit instead of the police. We're in the post-prohibition era. The police are the method of prohibition. Please, don't encourage people to call the police. This is your job. Something else on social media was a post about Delta 8. I find this to be, quite frankly, misinformation. Delta 8 has nothing to do with regulated cannabis. If you're worried about Delta 8, there are laws on the books. We passed them to deal with K2 and spice, synthetic cannabinoids that were in gas stations, in the same space that Delta 8 is today, sold by the same people. We got those things off the shelves with careful enforcement and laws that have already been passed. Laws that have catch-alls about all synthetic cannabinoids. Are you worried about Delta 8? Tell the cops to enforce the law. Don't put up social media posts to people like me. I'm an old cannabis consumer. I'm just an old Quaker stoner, I'm going in and looking at the dispensary menus every week. I don't see anything I can afford, literally. So, this is the view I have. I'm glad that we've made the progress that we have. I'm glad that we're licensing cannabis businesses. You heard from the public that we don't want any of our taxes going to the police. We don't want the NJCRC acting like the police either, or telling people to call the police. So please, you want public engagement? Right now, you're a brick wall to consumers and patients. You're hearing from us today. We're not hearing back from you. You need a consumer advisory board, a patient advisory board, and real public engagement. Thank you. Oh yeah, thank you. I pass this around. This is my presidential pardon for marijuana possession from President Biden. Please take a look at it. Thank you, thank you. And remember, the president and the vice president say nobody should be in jail for marijuana. So please don't tell people to call the cops about unlicensed marijuana dealers. Thank you.
The next 3 names on the list are Mayor Rosales, Guy Holtzman, and Jennifer Cabrera.
Hello, my name is May Rosales. First of all, thank you so much for having me here and having this opportunity. I'll try to be quick. I'm here to talk about, as a future wannabe delivery business, and some of the problems I know I'm having, and I know a lot of other entrepreneurs are having, is finding a location. And I'm here to speak only on a very specific part of that, is because the delivery license and the delivery vertical is right now lumped up together with most of the townships in the state of New Jersey as the same regulation, the same security. But for the most part, so therefore none of us can find locations. For the most part, a delivery business that is not connected directly to a dispensary, if I want to be a standalone delivery business, which means it's an office space with a desk and a computer and a telephone. It does not need a 24/7 security guards, and it does not need all the provisions and problems and regulations that the township put on those businesses, which right now are, just to put it out there, we can't open those businesses. It's almost impossible because every township, the few that do allow it, they limit the number of businesses, the limit of where you can have it. But at the end of the day, a delivery business is an office with a dispatcher. Hopefully, the bigger it is, we'll have more people working in it, but it's strictly an office without any product, without having anything that should be supervised. I am not saying not to have it supervised by the CRC, quite the opposite. I would like it to be supervised and make sure it's safe. And I'm just saying that my goal, my wish to the CRC Commission is to, just like the rule that a township cannot say, no one can deliver in our township, same blanket rule. Township must approve. It's a regular dispatch business in their township as long as it's not connected to a dispensary, as long as it's a standalone business. That is my point. I would like to say thanks again for all the hard work of everyone involved. Thank you so much.
All right. Hello, my name is Jennifer Cabrera. I'm with the law firm Vicente LLP. I just want to say off the bat, I'm really proud of New Jersey. So I work, we do only cannabis law, and I work in New York, Maryland, a few other states, and New Jersey is just killing it. So great job, everyone. I am here today to advocate for a rule change to Rule 6.8G. Tahir Johnson spoke to this much better than I can, and I don't really have anything to add beyond what he's already said. This is the rule that restricts you to being an owner of only one license. This is not 6.1G1, I'm sorry, 6.8G1, which has to do with family ownership. It is simply the requirement that you're only on one LLC or one corporation. And the problem here is that if you're raising money, you need to have separate companies. There's no effective way to do that with one company. If you get separate investors for cultivation, which you're probably going to need, because cultivation is hugely expensive. So it's much more expensive than retail. So you need to raise money, which means you probably need to do it through a different investment vehicle. This affects small businesses and minority-owned businesses so much more than big companies, because they can be vertically integrated, and that's fine. But if you're a small business, you need to find funders, and that's hard enough. So that is the request I've made. Thank you.
Hello, my name is Guy. I'm the co-founder of a company called Triplet. Our idea is to connect dispensaries and delivery companies together, basically creating what, if you would, a cannabis DoorDash for the state of New Jersey. And Mayor here previously spoke about something that I also wanted to speak about. In order to start our business, we spoke with a lot of guys who want to start a delivery service. We spoke with them about their difficulties, and there is a lot of difficulty in getting a delivery business up and running. He already spoke about the technical side. I don't want to take too much of the commission's time. I would like to say on the economical level, what will happen eventually, in 2024, we're going to get to $1 billion. Eventually, this business will go into delivery. Like consumers, adult consumers will take delivery, as they consume from restaurants and take it into their homes. What will happen is you will form oligopolies and monopolies. Because the delivery service licenses is so scarce, you will have certain amount of companies controlling that. Now, for me personally, in my business, it's good because that means I get to connect with minimum companies as possible. But that's not what this is all about. We want to have as many companies out there. We want, as you said, Commissioner, to have as many people involved in this business. And it's something that I think you guys should be aware of. In particular, this is happening in South Jersey. North Jersey is more advanced, maybe because of the proximity to New York, I don't know. But in South Jersey, towns are not allowing anybody, almost completely. I'm from Cherry Hill, nothing in the proximity of having a delivery. I'm not talking about dispensaries. And I think this is a problem that the committee should address. Thank you so much.
And last, two names on the list are John Harmon and Osbert Orduña. I'm just going to go over the names that I called that did not speak up. If you're here and you missed your name, this is your opportunity. David Fetter, Susan Sciaretto, Matha Figaro, Brian Naranja, Eric Ifergan, John Marchetti, Carlos Almanzar, Walter Iwaki, John Harmon, and Osbert Orduña. Chairwoman Waynu, this looks like we'll conclude the registered speakers we have for today's public meeting.
Thank you, and thank you to everyone who shared their thoughts, their experiences, and their ideas with the commission today. As a reminder, if you ran out of time or if there was something that you were not able to share with us today, by all means, go to our website to submit comments in writing at nj.gov/cannabis/meetings. And the deadline to submit your written comments to us is 5 o'clock tomorrow, Friday, February 16th. So this concludes the business that we have before us today. Is there any new business for the commission to consider? Hearing none, is there a motion to adjourn?
Madam Chairwoman, I move that we adjourn.
Moved by Vice Chair Delgado. Is there a second?
Second.
Seconded by Commissioner Del Cid Coso. Thank you, or else we'd be sitting here like lonely, like lost ducks. Is there any discussion on this motion to adjourn? Hearing none, all those in favor of adjourning say aye. Aye. All those opposed say nay. Any abstentions? Hearing none, motion passes. The time is now 3:02 and we are adjourned. Next meeting is scheduled for March back here in this room. Thank you so much.